There are two words which underpin the reasons why Healthier Lives Heiranga Haora National Science Challenge, with support from A Better Start and Aging Well, have planned this korero: frustration and optimism. Frustration of researchers because their research outcomes, which they believe could improve the health of New Zealanders, are not being implemented. Frustration of policymakers, who often feel that they're being bombarded with a surfeit of research ideas and no clear pathway for evaluation and prioritization. And also frustration on the part of healthcare providers, who not only share the frustration of policymakers, but are often prevented because of lack of funding from implementing measures which have the potential to reduce the inequities in health outcomes, which we all know exist in Aotearoa. Of course, I have no brief to talk on behalf of all researchers, all policymakers, and all healthcare providers, but I do talk frequently to people in each of these categories and feel that I'm able to express the views of many. However, there is cause for optimism. The current reforms of the health system provide a not to be missed opportunity to reset the pathways between research, policy, and practice. At present, from the perspective of someone like myself, who has been involved in research and clinical practice, and at times been called upon to provide policy advice, the pathways, in as much as they do exist, appear to be somewhat random, and there is clearly room for a more systematic approach to the uptake of research evidence into policy and practice. A second reason for optimism lies in Te Arapairangi, the Future Pathways Green Paper relating to research, science, and innovation, which was released for consultation just a few weeks ago. There's a section there which relates to better impact delivery, knowledge exchange, and research impact. And that includes some sentences which would have served well as a subtext to the title of today's webinar. Unfortunately, the paper emerged after we had finalized the program. I quote, "We could consider if any barriers exist to getting ideas out of the research system and into the hands of end users. We would like to know how we might identify these barriers and mitigate them." End of quote. And I hope there might be some clues from today's webinar. We acknowledge that the required pathways are likely to be complex, but our ultimate aim is to contribute to a learning system capable of integrating new knowledge, practices, and technologies, which will contribute to an evidence-informed and equitable healthcare system in Aotearoa, one which truly respects the principles of Te Tiriti o Waitangi and serves the needs of all for whom Aotearoa is home. The last comments really to make is really to clarify that we don't expect today's presentation to be the last word, but rather it is the start of a conversation. There will be one and possibly more workshops to further pursue the ideas which are presented today. We will produce a report which we hope will help to inform the work of those who are planning the new health system.